I do see your notes on the slide.
Okay, I'm going to turn those off. Thank you. Hello, everyone. We're going to give everybody a few minutes to join us. I see that there are quite a few people already on, so just 1 or 2 more minutes and then we'll get started. Okay. We are at the top of the hour, so I think we'll get started. I hope you all are well, and even in these uncertain times that you're doing okay. And thank you for joining us today for our webinar. Today's webinar is on immunization supply chain system design, and this is the first of a 2-part webinar in which we will discuss the elements of and the process for supply chain design, redesign, and optimization. Just to introduce ourselves, my name is Barbara Lamphere, and I am a Senior Technical Advisor with JSI, and I'm joined today by my colleague, Greg Roche, to present this webinar. Just a little background about me. I've been working to build organizational and individual capacity in supply chain for over 30 years and have had the opportunity in many cases to work with colleagues to design their health supply chains in many countries, including Tanzania, Myanmar, Ghana, and other places. Greg, do you want to say a few words about yourself, please?
Yeah, sure. Hello, everyone. My name is Greg Roche, and I'm a Senior Technical Advisor also at JSI. And I've had the opportunity to work for about 20 years in supply chain. And most recently, I've been working with immunization supply chain optimization in Madagascar, Guinea, and Niger. And I'm very happy to be with you today.
So we're pleased to welcome back many of you who participated in the previous immunization supply chain series on immunization supply chain leadership. This new series, Greg will give you some more information in a minute, but we're welcoming you those back. And to those of you who are new to our immunization supply chain series of webinars, we are happy to have you join us.
Okay, thank you. So as Barbara just mentioned, this is our first webinar in our new series, Ensuring a Responsive Immunization Supply Chain. And you'll see here that this series has 4 webinars, which include the topics of immunization supply chain design, preparing the supply chain for new vaccine introduction, and managing the inventory of cold chain equipment. We're starting this webinar series with immunization supply chain design because a well-designed supply chain provides a solid foundation for a supply chain that can respond to changes in products, policies, and resources. Please feel free to introduce yourselves to each other. I see some of you already are, using the chat function. Tell your colleagues your name and where you work. We will leave time for questions at the end of the presentation. If you have a question during the webinar, please use the question answer function by clicking on the Q&A button at the bottom of your screen. Now, on to today's webinar.
Let's briefly review the objectives of the webinar. In this webinar, we will discuss the basic elements that you need to consider when designing an immunization supply chain system. Our discussion will be applicable whether you are starting from scratch or assessing the system for redesign or optimization. Our additional objectives are to identify the various supply chain components that need to be considered when designing an in-country immunization supply chain, and to identify specific design considerations related to each of the following supply chain components: the products, the in-country pipeline, and what that design should look like, inventory control system, the logistics management information system, distribution system, performance management system, and last but not least, the personnel and human resource requirements. In the next webinar, which is Immunization Supply Chain Design Part 2, we will focus on system redesign and optimization and spotlight the optimization of the supply chain in Zambia. Before we move on in the webinar, I would like to actually start a little poll to find out a little bit about you. So I'm going to launch a poll and ask your experience in supply chain design. So you should see on your screen a series of 5 questions, yes and no questions. The first question being, have you ever participated in a supply chain design activity? Have you participated in a supply chain redesign or optimization activity? Was the supply chain design, redesign, or optimization specifically for an immunization program? Was it for other specific programs other than immunization, or was it for an integrated system? So let's learn about you a little bit. So let's give a few minutes for that. Just a few more seconds here. Quite a few people have experience. This is great. Thank you for so many of you participating in the poll. So far, more than 70% of you have answered the questions. That's great. Okay, I'm going to end the polling now and share the results. Let's see. So it looks like quite a few people 69% have participated in some kind of supply chain design activity, and even more have participated in a redesign or optimization activity. And it's true, many times we don't start from scratch. We are often doing redesign or finessing or improving an already existing supply chain. 49% of you have done this specifically for immunization programs. More of you have done that than for other programs. 39% have done it specifically for programs other than immunization. And it's almost evenly, about half of the people of our participants today have participated in a design for an integrated system. So we have quite a bit of an experience with this group today. And so I look forward to your questions and discussion towards the end of the webinar. I'm going to stop sharing the results and we can continue on. And then I look forward to what you can contribute in the discussion towards the end, given that there's so many people with experience here. Okay. So as you see from this list of components that we're going to cover today, there's quite a lot to consider. And we won't be able to go into great detail in each, but we'll cover the basics and provide references for more in-depth study. And then when we get to part 2 and the next webinar in September, we will get into more detail on optimization and redesign. So let's go on. So let's start with defining supply chain system design. Health commodities for all health programs need to move from the point of entry to service delivery points. We all know this, usually through intermediate storage facilities, in order to meet the goal of a supply chain to provide the right quantities of the right health products in the right place at the right time at the right cost. The purpose of designing a supply chain is to optimize the flow of commodities and information and to standardize the related business processes to manage these commodities and information. The objective of the design or redesign is to achieve the performance desired, ensuring continuous product availability, making the best use of the resources available. So as I said, rarely will you be designing a supply chain from scratch, from the beginning, or doing a complete overhaul. Supply chains evolve, and based on the performance of the current supply chain, you may design or redesign one or more elements of the supply chain system. For example, if during an assessment activity, you decide that you are holding too much stock across the system and you're seeing high closed vial wastage rates, you may want to, in that case, consider a redesign of your inventory management system. So we may only be looking at one component of a system in a redesign activity, or it could be several. In this webinar, we're covering the basics of supply chain design, and we'll use the words design and redesign to mean establishing the flow of commodities and information and the processes used to manage commodities. In the next webinar, we will focus on optimizing the design, or how to make the supply chain design more efficient, taking it to the next level, improving its performance, and making better use of resources.
When embarking on a supply chain design or a redesign activity, you'll be answering some or all of these important questions and many more. What products will be managed in this supply chain? How many levels should there be in the pipeline? Should the system be a push or pull system? Between which levels? What data should be routinely collected and reported? And how often should reports be submitted? What inventory control system should we use? How will we measure the performance of the immunization supply chain? What are the storage requirements for the products being managed? What quantities of products will be managed? How frequently should products be resupplied to storerooms and service delivery points? and what staff positions are needed to manage the supply chain, and how many people will be needed. For each component of the supply chain, you will be making decisions that will establish the overall structure of the supply chain and the operational business processes that become the routine work of the supply chain. While we will not be able to get into detail about each component of supply chain design in this one-hour webinar, we will discuss considerations for the design of each component listed here. We will also provide some reference documents in the follow-up email to this webinar that will provide you more guidance on designing your immunization supply chain. But first, let's spend a few minutes discussing the supply chain design process. The design process starts with scoping, determining whether a system requires design or redesign, and whether all components need to be redesigned for a new system, or what components of an existing system need redesign. The scope usually emerges as a result of an assessment that points out the strengths and weaknesses of the system and the performance desired for the system. The analysis step in the process may also point out further elements that need to be redesigned. The analysis step provides evidence to support design decisions. During this stage of the design process, you look in depth at strengths and assets of the system and chronic or occasional weaknesses. Often, this will involve assessing human resource capacity and doing business process mapping, and a complete evaluation of the information system. A network analysis might also be done to assess the efficiency of storage and transportation nodes. You might also do a cost analysis and possibly a segmentation analysis. The design step uses the information collected in the analysis step to inform the supply chain design decisions. This design activity may take place during a large multi-day workshop with key stakeholders or through a series of consultative meetings. Often, the structural aspects of the design are decided first: levels in the system, transportation routes, and so on. Then, the business processes and roles and responsibilities needed to operationalize the system are detailed and documented in a standard operating procedures manual. Implementation of the newly designed system or the redesigned system will include preparing the tools, documents, and SOPs needed to manage the products, training staff in their roles and responsibilities, creating the teams who will work together to operate and manage the performance of the system, and many more aspects. It is extremely important to monitor the performance of the system or any newly redesigned component of the system over a period of several ordering cycles to ensure that the system is achieving the desired performance goals.
Okay, so now let's start looking at the design considerations for each of the components of the supply chain. And we'll start by talking about the products that are managed in the supply chain. In our case, specifically vaccines and products needed to provide immunization services. It's important to consider the characteristics of the products managed in the supply chain to ensure that they arrive at the service delivery point in the best condition. So you want products to arrive so that they can be used before they expire. So you want to make sure that the pipeline through which they flow is not too long and the amount of inventory held in each level of the pipeline is not too great. For example, if the sum of the maximum levels for your pipeline through which they flow, the pipeline is 28 months, yet most of your products you manage have a 24-month shelf life, they will expire before they reach the client. So when we're designing the pipeline, we have to consider the shelf lives of the products. And of course, as products arrive into your program, they don't arrive freshly off the manufacturing. So it's important that we consider the shelf life of the product in comparison to the length of the pipeline. This will obviously this length of pipeline and your product expiration will need to be taken into account when determining the flow of the products as well as your inventory parameters. And as we all know, the vaccines we manage in an immunization supply chain need a reliable cold chain for storage and transport. So when we're designing the immunization supply chain, we need to ensure that products are maintained at appropriate temperatures throughout the storage and transportation. We need to have a good idea of the current and potential infrastructure at each level of the pipeline to be sure vaccines are kept according to their requirements. And not all vaccines, as we know, require the same cold chain conditions. So you will have to consider capacity for cool, cold, and frozen storage. Other products may pose different storage requirements. For example, if you have any flammable or hazardous products, they need to be stored separately from pharmaceuticals and vaccines. It's also important when you're thinking about your design to consider what products are used in combination or are required for administration of the vaccines, etc. For example, in order to administer vaccines, you will need the appropriate adjuvants and syringes. Certain medicines, if we were thinking of an ARV supply chain, you wouldn't have you would need to manage a set of products or a regimen of products together. The absence of one medicine in a regimen can mean that a clinician may not be able to provide medications. So, for example, when you're developing your LMIS forms, your information forms, your records and your registers and your reports, you can design those forms to make sure that those products that are being used together are ordered at the same time, and the design of the inventory control system can also facilitate making sure that those products are ordered and managed together. Some products may be used at certain types of facilities, such as referral hospitals or specialized laboratories. So when designing a supply chain, it's important to know where and in what kinds of facilities products are used. So you really do need to know quite a bit about the products. And then of course, it's important to understand the quantities of products moving through the system in order to understand the storage and transportation capacity required or the frequency of resupply. There is often a balance in supply chain design. If products are replenished frequently, then less storage space is required at any one level, but then more transportation is required. If replenishment is less frequent, more storage space is needed, but less transport. This is an important consideration when thinking about cold chain capacity. If your cold chain capacity is limited, then possibly more frequent resupply would be an important consideration, and therefore would have an effect on your inventory management system. When determining the volumes of products that will be managed in a system, for a new system or a new product where we don't have much experience, we're likely going to be using some morbidity or demographic data to figure out what the quantities are now and in the future. And for products that we've already have a lot of experience with, we may use consumption data to calculate things like resupply or forecasted demand. So we have several considerations around the products. Let's think about pipeline. Once you have considered the volumes and requirements of the products you are managing, then you can look at the overall structure of your pipeline. First, identify the service delivery points through which clients receive the products. Where do your clients get their products? These may be through community health workers and basic and more comprehensive health facilities, such as dispensaries and health centers, hospitals, and reference hospitals. You may also have hard to reach or community level facilities that are resupplied less frequently and could be assigned a different max and min stock level than other service delivery points. After identifying the service delivery points, the points where clients get their products, you map out the supplier of the products to those service delivery points. Often there are several intermediate storage and distribution points already in place, including, say, district warehouses, regional warehouses, and usually a central warehouse. To create the pipeline for vaccines, you need to think in particular about, obviously, the cold chain requirements and which intermediate storage facilities have the cold chain capacity needed or could be equipped with the capacity. Keep in mind that you're not required to involve every administrative level in storage and distribution. Some tiers in the system may be more appropriately assigned management roles, such as monitoring and supervision, and not be responsible for storage of products. So for example, you may have a multi-tiered pipeline and then transition that pipeline to having several tiers in which products are stored and reducing those tiers, as this diagram shows. This is from Ethiopia, how they've streamlined their distribution and their storage and distribution, and they're reducing the length of their pipeline. In general, the fewer number of tiers you have in a pipeline, the less product is held in inventory, which means less money that is required to fully stock your pipeline. But the fewer tiers may mean that any one warehouse may be delivering to more SDPs. For example, if you eliminate the district level, the regional level may now make deliveries to many more service delivery points when compared to a more limited number of districts it previously delivered to. So therefore more transportation is required and more, obviously more manpower. There's always a balance. Fewer tiers may mean more transportation capacity needed, but less product in inventory and less storage required. Products will also reach the end user more quickly than a pipeline with more tiers. One thing to think about is segmentation. And we discussed this strategy in a previous webinar on managing vaccines with other health commodities, and I will provide a link to that webinar in the resources that I send in the follow-up email after this webinar. If we remember from our segmentation examples in previous webinars, public health programs obviously manage a large variety of products with many characteristics, going to diverse groups of clients through many different kinds of facilities. So when you think of procuring, storing, or delivering all of these products in the exact same way, it doesn't make sense, and you would not achieve 100% availability. So segmentation is this process of analyzing data about customer needs and product characteristics to determine which segments or groupings of products make most sense to procure, store, or deliver together. This process is used extensively in the commercial sector, and now we see it more often in the public sector to identify groups of products that are appropriate for integration. For example, and we talked about this example in the previous webinar, you might group vaccines with other cold chain items, such as oxytocin, which is a maternal health product used for the treatment of postpartum hemorrhage. And there's some specific antibiotics that also require cold chain. These products might be stored and transported together as a single supply chain segment within the same overall supply chain organization, but these products represent one segment. The procedures for this specific cold chain segment would likely be different than those for other products. For example, if you have one segment, the distribution may be direct, say from central level to the facility, possibly on a different resupply frequency than a segment with other products, and with different maximum minimum inventory stock levels. Another consideration when we're thinking about our pipeline and sort of the structure and the flow of products through the pipeline is determining if the system should be a push or a pull system between levels. Just as a reminder, I know many of you have taken supply chain courses before. We'll review these concepts. In a pull system, the receiving facility calculates the required resupply quantity. While in the push system, the issuing facility calculates the resupply quantity. In either case, the person doing the calculation would use the same consumption and stock on hand data and maximum stock quantity to calculate the resupply quantity, and both would end up with the same quantity required. If there is a shortage at a resupply facility, then the full resupply quantity needed may not be issued, but that does not change the actual resupply quantity calculated as needed. And I want you to be sure, don't confuse push with rationing or dumping. Now, there's quite a lot of information in this slide right now, so you can have a minute to look at this. But when considering whether or not you're having a pull relationship or a push relationship between different levels in the pipeline, there are advantages and disadvantages in choosing which system you decide for your relationship between levels. Particularly, these differences happen between training requirements and workload. So for example, if your service delivery point is sending data but not actually calculating the order, they have less work to do. The regional store in this diagram would be calculating the order, and therefore the workload is distributed up to the regional store for doing the calculations. So fewer people would need to be trained to do the calculations, only those at the regional store. The SDP could be focusing on serving customers and less on logistics. And while you may have a push system between two levels in the pipeline and a pull between two different levels in the pipeline, you do not mix pull and push usually between this and the same level within the supply chain, within a supply chain segment.
Okay, great. So once you identify the pipeline structure, there are several considerations that go into the design of the inventory control system. One consideration is how frequently each level in the system is resupplied, and we call these the resupply intervals. Once again, you will need to consider the balance between availability of transportation and storage capacity. The more frequently a facility is resupplied, the less storage space that facility needs to have, but more transportation will need to be available. Resupply intervals are generally monthly, bi-monthly, or quarterly, and usually align with reporting frequency. And if using segmentation as a strategy, some products may have different resupply frequencies than others. Cold chain products, for example, could be distributed to the smallest facilities more frequently to avoid need for more storage and to reduce the risk of expiries or cold chain failure. Once you settle on a distribution network of warehouses and facilities, and which facilities are resupplied from where, then you can establish a maximum minimum inventory control system, setting max and min stock levels and emergency order points. Remember that stock levels take into consideration the resupply intervals, estimated lead times, and buffer stock requirements. The establishment of an inventory control system helps storekeepers and logistics managers know when to order or issue and how much to order and issue, and parameters by which to determine if they are adequately stocked. When first establishing an inventory control system, it is better to set slightly higher max-min and emergency order point levels, and to then adjust the levels once the system is better established. An essential component of every supply chain, no matter what the product managed, is the information system that provides data used by managers to make supply chain decisions. LMIS design starts with identifying the decisions to be made, who makes those decisions, and at what frequency. The most basic supply chain decisions include how much product to order, issue, move, store, and more. To make these types of decisions, supply chain managers need to routinely have stock on hand and consumption data collected on stock keeping and consumption records and routinely reported using summary reports. To have full accountability of product in transit, transaction records are needed, and feedback reports provide upper-level managers information on supply chain performance, which can direct them on how to improve the system. And workers further down the supply chain can be given information about their performance to help motivate and encourage improvement. These are the basic elements of an LMIS in every health supply chain. Because immunization managers need additional information to monitor and improve the performance of the cold chain, additional temperature monitoring and cold chain equipment records are maintained, and those data are also reported, along with other data requirements such as open vial wastage. In all cases, only data that will be used to make decisions should be collected and reported. When designing an LMIS, you need to consider which parts of the system could be automated, or if the entire system can be automated based on what infrastructure is available or what can be made available for automation. Frequency of reporting often aligns with frequency of resupply, as the data to calculate orders are reported through the LMIS. Another consideration is the level in the system where data may be aggregated. The main concern here is to ensure that managers have visibility into supply chain performance throughout the system. This can be masked if data are aggregated. An automated system that allows for aggregated and disaggregated system would be the best. Many components of supply chain design are interconnected, with the design of one component influencing the design of another. For example, when designing the LMIS, you need to consider how it supports and aligns with the inventory control system. The frequency of reporting may be the same as the frequency of resupply, and the maximum stock level may be included as part of a formula on a combined ordering and reporting form. Similarly, the design of the distribution system needs to align with the desired flow of products through the pipeline at the frequency dictated by the inventory control system, and taking into consideration the expected volumes of products moving through the system. During the design process, we need to answer such questions as who delivers or picks up the product, and what vehicles have sufficient space and cold chain capacity, or what is the availability of passive cold chain equipment. Distribution routes should be mapped out to minimize transport time between storage facilities and between storage facilities and service delivery points. The best routing may not always strictly follow administrative levels in the pipeline. Decisions on distribution system design also need to take into consideration road, rail, and other transport infrastructure, as well as availability of drivers and budget. Real consideration should be given to outsourcing distribution to private transport carriers, so long as they can guarantee adherence to cold chain and other requirements.
Okay, there are a few last components that we're going to talk about before we get into any discussion. This one is on the performance management system. A critical component of the supply chain design is that design of the performance management system. This system should enable managers to easily see how well the system is meeting the objective of ensuring continuous availability of quality vaccines at service delivery points. Outcome and process indicators should be chosen during the design process, and the LMIS needs to be designed to include the data that help us inform these indicators so that we can calculate these indicators on a routine basis. The automated LMIS should be designed with performance dashboards, which support decision-making by central and intermediate level managers and allow them to anticipate and prevent performance problems or take corrective action as needed. We, as discussed in a previous webinar on managing immunization supply chain performance, an effective strategy to improving supply chain performance is to establish data review teams who are responsible for routinely reviewing supply chain indicators, identifying problems, developing solutions, and taking action. These teams can be designed as part of the structure of the supply chain organization and should be discussed during the design process. The last component of the supply chain design that we're going to be talking about, but probably the most important, is determining the personnel needs to manage the supply chain. When designing a supply chain and defining standard operating procedures, specific staff positions need to be designated as responsible for each task in the SOP manuals. While ideally, there would be dedicated supply chain personnel to manage supply chain activities at every level of the system, we all know that this is rarely the case. Often personnel who have additional management or service provision responsibilities are also tasked with supply chain responsibilities. The design of the supply chain should take into consideration the availability and the capacity of the human resources, and when possible, the design of the workflow should take into consideration the workload of staff, particularly those at the service delivery level. For example, an informed push system, if you choose that system, which the push system to say to the service level, it reduces that logistics burden on service providers. In this model, the issuing level travels to each health facility with something like a moving warehouse. They collect the logistics data while at the facility, along with the standard monthly reports. And they calculate the orders and deliver the supply at the time that they are in the facility, making it very easy for the service providers. Another consideration in design is also whether you have a supply chain management unit. This unit could be developed with the responsibilities, whether it's supply chain management units at central level or lower levels of the system, and could take responsibilities similar to data teams for reviewing the data on a regular basis and also helping to make decisions and managing operations. An important consideration for your human resources is how you're going to continue to develop your staff and retain that staff, protecting the investment that you've made in the personnel that are working in supply chain, whether this is through capacity building and training, or even considering a professionalization or career path for people to advance in their supply chain careers. Before we end this, I would like to actually take us through a walk through an example of a supply chain design, illustrating several of the components that we have discussed so far. So to start with, here is the family with children who need vaccines, a family who are customers of the supply chain. They can get their services from a number of different service delivery points, including from community health workers. During the design workshop, it is decided that the community health worker would get their supplies while attending monthly meetings at the health facility, and service delivery points get their commodities from the district And then in turn, the district gets its commodities from the central medical stores. So there is the pipeline that is determined in the design workshop. The relationships between these levels in the system are also discussed and determined during the design workshop based on available manpower, storage, cold chain, and transportation capacity, and the results of an network analysis prior to the design workshop. So for in this case, we would see that we have a relationship between the central medical stores and the district medical health office and store, where it's a pull system with a quarterly resupply and an estimated 6-week lead time between ordering and receipt of the new product. Between the district and the service delivery point, it was decided in the workshop to have a push relationship with monthly resupply and determined that it's a 2-week lead time. And as mentioned previously, at the lowest level, the community health worker picks up the supply at the monthly meeting, in which case there really is no lead time. In addition, another aspect that was designed during a design workshop would be the inventory control system. So based on these decisions of frequency and lead times, the determination in the workshop would have possibly be a forced ordering maximum system, and then these would be the maximum and minimum stock levels that are designed in the workshop. Stock cards and dispensing registers are agreed to for records, along with a standard monthly report form for use by SDPs and a requisition and report form for use by the district. We see by the blue lines that the data flows up the system for use at each level in decision making, including by the central supply chain management unit. So in this case, the design included a supply chain management unit, which receives data, instructs the CMS, the central medical stores, and how it should resupply, tracks performance at every level in the system using the data that's been reported in the LMIS. And hopefully proactively can prevent problems by seeing potential supply imbalances and shortages within the system before they become a problem. This is an example of the design decision-making that goes into the supply chain system. Each supply chain design needs to be customized to the local infrastructure and the realities on the ground in the supply chain. So this is an example that sort of pulls together all the different components that we've talked about today. So this is the end of today's webinar. And during this today, we have defined system design, system redesign, and optimization. We've identified the various supply chain components that need to be considered when designing an immunization supply chain. And we've identified several specific design considerations related to each of the supply chain components we address here. So let's take some time now to answer some questions that have come in the Q&A. So I'm going to look at some of these questions and read them aloud. And some of them I'm sure may be suggestions and so forth. Okay, so the first question coming in, is there a specific period of time to implement a supply chain redesign plan? Okay, so one of the things about implementing, if you've redesigned your supply chain, usually what happens is there's a certain amount of time, obviously, to inform and build capacity around any changes in standard operating procedures. So if you were to change the resupply frequencies or the maximum or minimum stock levels, or added a different form, or beginning to use a new form, there's going to be some time period to introduce those new processes, those new business processes. Then once people are informed or trained in those new business processes, usually what would happen is that you would want to go through a few ordering cycles using those new processes to test them out and monitor the performance during that time period. So if you have reset your your maximum stock levels, and you've lowered those because to create more efficiency, then you want to monitor that to make sure it's not resulting in shortages and so forth. So usually to implement it, you would take several ordering cycles. So in my experience, it's usually about from the time of redesign through really being confident that it's fully functional and you've tweaked or you've made any adjustments or revisions. It can be 9 to 12 months to really get that redesign out fully functional. Greg, do you want to add anything to that?
No, I think that's perfect. I think that 9 to 12 months is realistic. You want to see the performance of your supply chain and then see if you need to make any adjustments.
Okay. There was a question of, will we talk about integration between immunization, supply chain, and other health commodities? We already had a previous webinar on that, and I will share that with you all in the follow-up email. To anybody who's in this, you'll get in this webinar today, you'll get a follow-up email. Is there a relationship between health policy and strategy in supply chain design? So, Greg, do you want to take that one? The relationship between health policy, strategy, and supply chain design?
Yeah, I'm happy to answer or try to address that question. I think absolutely there's a relationship between your health policy and your supply chain. So for example, in some countries, they want to create a situation where no one has to travel more than a certain amount of time in order to access health services. So let's say they say every client should be within 1 hour of a health service provider. If that's the case, then you're going to have so many health service providers across the country, and your supply chain is going to be able to need to be able to reach all of those service providers somehow. So absolutely, the supply chain that you create is going to be based on the number and location of the service delivery points. So there's a huge relationship. There's a strong link between those two. And if your supply chain is not going to be able to provide those services, then your health policy needs to be adjusted so you don't have that requirement.
One of the things that I think we said early on is that one of the reasons we're doing sort of this first webinar that's sort of on foundational supply chain design before we get into optimization is that we do need to, when we're creating a supply chain, we want to make sure that the foundation is strong enough that should there be changes in policy, that the supply chain can be easily adapted and adjust. So health policies may include also changes in treatment regimens or introductions of new projects or a switch of emphasis from vertical programs to integrated programs and so forth. And so the supply chain should be able to manage products irregardless of some of these changes or to be easily adapted. So if we have a strong LMIS and a strong inventory management system, they should not need any redesign if you were to add a new product or change a regimen or something like that. So that strong basis is very important. There's a question here about when is a program ready for supply chain design or redesign? I think, one of the things that's very important in all supply chain management is to monitor the performance of the supply chain on an ongoing basis. We can do periodic assessments or evaluations of the supply chain, but this ongoing monitoring will start pinpointing or identifying problem areas. So if you're on ongoing monitoring and you're seeing a lot of emergency orders, or you're having problems with reporting rates or other things, that's a time to step back and say, we have some chronic weaknesses here. And we should do so. And that's a time when you would want to look at a redesign. Now, I'll give you know, after a system has been working for many years, I know in one country where I work, where the supply chain was designed and really rolled out in sort of the early to mid 1990s, and it ran was well established and ran successfully for many years. It was felt it was time for redesign, because if a supply chain has been moving and evolving for many years, and procedures are well established and so forth, you can actually want to do a redesign to make it more efficient. Could we lower the maximum stock level rates? Could we get data more quickly because of automation? Could we add these new things that would increase efficiency as well as effectiveness, lowering our costs, because now people are more able to manage the supply chain well. They've been doing it for years. So let's take it to the next level. And when we do the optimization webinar next month, we'll really get into, you know, when is it time to like move to that to optimize it, to take that supply chain and make it more efficient. So if it's been running for several years, it's probably time to look at it again. So someone has written, looking at the future pipeline, are saying is the push system the most efficient, or are the systems integrated and automated? I'm not quite sure about if I understand the question entirely. So one of the things about push systems, and Greg, I don't know, do you want to talk about this one? Let me just say a word first. So the systems, the more you become an automated system, the less you rely obviously on the human factor, and you can create efficiency. So if you go, you know, if we were to look at our modern retail situation, a lot of those retail facilities are using automated systems with barcodes where consumption or user data is transmitted automatically, and the computer is actually calculating the resupply quantities and alerting managers when for potential problems, or alerting them when it's time for a resupply. So push systems, as we become more automated, actually do create some efficiency, taking some of that workload away from the humans in terms of the calculations and the queuing of when something needs to happen. But that efficiency usually happens when we employ automation and barcoding and other aspects of supply chain design. Greg, do you have anything you want to add to that?
No, thanks. I think that's perfect. I think as long as you're automating, then you're in the computer. So why not make the computer, or let the computer do the work for you?
Yeah. Someone said sometimes we talk about informed push system, IPM. I'm not sure what that is. I guess what is the difference or the addition of the push system? I think an informed push system, so there's a kind of inventory management system. We called it historically in the old days delivery truck topping up system, which is now the informed push system. And that's when the upper level is actually, I mean, whether it's push or pull, hopefully it's both informed. They both need the same kind of data, consumption data and stock on hand data for any resupply calculations. But an informed push system, I think over the years has that idea of someone coming, collecting your data, or taking your data and doing that work of calculating your resupply for you is really sort of the crux of the informed push system. There are a lot of questions, a lot of discussion on push and pull here. I'm going to try to find something a little bit more here. Oh, please explain scoping step in the design process. Greg, that was, since you talked about that, I'm going to let you take that one.
Thanks. So I think scoping is basically taking a look at it's almost like an assessment. It's looking at the current situation. It's thinking about what elements of the supply chain might be might be ready or might need to be redesigned or improved. It could be taking another look at the products that you're managing. It could be taking another look at the inventory levels, the stock levels of maximum minimum, and things like that. So I think that's what we pretty much mean by scoping, is getting us a sense of what's the current situation.
Right. Okay. Great. There's so many questions today. This is great. There's just a comment here. Data source confidence is very important. Yes, in any supply chain, having confidence in your data and the data that you're using for decision making is really important. But one thing I want to say from years of experience, you know, you shouldn't wait around until you have perfect data to use that data, right? And the more that people seeing you use data and realize that data is being used for things like forecasting, for quantification, for resupply, for monitoring, the more that people who provide data see the importance of how that data is being used, the better they will get at reporting, and the better quality they will be, more responsive to providing you with quality data. So while some people say, well, we can't use this data, it's not good enough, I think you need to begin to show people how data is used in order for them to start giving you better data, and then people building that trust and confidence over time in the data, rather than just saying we can't use it. Oh, this is a question we can't answer yet. What's the storage temperature of COVID-19? I have no idea. We are hoping later on in the series to do a webinar on new vaccine introduction, as we understand, using some examples from other vaccines, but also considering the COVID-19 vaccine, whichever it might be. But we will be discussing that more in a future webinar and so I can't answer the question about storage temperatures for the COVID-19 vaccine yet. In terms of segmentation, what happens if a short shelf life product, for example, is also a high value one? Well, if you're segmenting, you want to consider, will you be handling the high value one differently than the cold chain products? I think you need to think about which of those characteristics is going to be the determining factor for this segment. I don't think that the value necessarily would change the segmentation for, say, a cold chain product. I think that the cold chain one trumps the value one in terms of how it's managed within the supply chain. Of course, for high value products, for any product, we need to have enough accountability and for the product, and safety and storage. So whether for any high value products, but all products are valuable. So I think the short shelf life characteristic is the one that would probably be the one that would trump the other. But also, when you think about it, if it's a short shelf life product, it's probably not going to be stored in multiple. It probably would be managed more carefully, distributed from central to service level, probably because of shelf life issues. Therefore, it's fewer levels of accountability that would be needed. It's not being held in the intermediate, maybe held in intermediate levels. So it could be, the value could be also accounted for with the short shelf life. Someone said, in my experience, Greg, do you have anything to add, actually?
No, thanks.
Okay. Someone's asking about standardized training manuals for staff training while redesigning. We will share with you several documents that would inform either a redesign process and also help you with thinking about rolling out your redesign process and the training. A question: do system design processes typically consider revisions to acceptable storage rates for acceptable wastage rates for vaccines? any info on how this process occurs, or typical steps to take to figure out the most appropriate wastage rates for vaccines that will balance efficient usage of products and health worker fear of wasting multiple dose vials. So this is a consideration of revisions to the acceptable wastage rates for vaccines. Greg, do you want to take that? And I think we're almost over. We're getting over time now. So do you want to take that last one, and then we'll move on and say goodbye?
Yeah, sure. Honestly, I'm not so aware of what countries might consider to be acceptable wastage. I know that when you're talking about vaccines and you've got the multi-dose vials, you have to accept some wastage because it's likely if you're using, for example, a 20-dose vial, it's probably likely that you're not going to be able to use all of those 20s before it's no longer good, because obviously you can only use it for a certain time after you've opened the vial. But I do know one of the considerations that when I was doing some work in Botswana and we were looking at vaccine wastage, we actually did a quick analysis and found that if you can buy what do you call, like 10-dose vials or 5-dose vials instead of 20-dose vials, it actually does not end up being more expensive, even though the cost per dose might be a little bit higher because the wastage is actually lower. So, I mean, that's a great question, and it's something that the countries have to consider. What do they consider to be acceptable wastage, and what do they consider to be acceptable cost per dose?
Thank you, Greg. I would like to thank you all for all your great questions. There are several questions we didn't get to, and I will try to address some of those in the follow-up email that I'll send out at the end of, after we receive the recording of this webinar. And so you will get additional resources, and we'll try to address some of your other questions that we didn't get to today. In that follow-up email, you also get an evaluation form and, of course, the recording of this webinar. Thank you for your participation today, and we hope you'll participate in our next webinar, which is going to be on optimization. We'll feature the Zambia immunization optimization. That's going to be on Tuesday, September 22nd. I will send a link for registration for that webinar and along with the follow-up email. I just want to remind you that anybody who attends all 4 of the webinars in this series, whether it's live or recorded, will receive a certificate of participation. Thank you so much once again. Stay safe and be well, and we hope to see you next time in the next webinar. Take care. Bye.
Thanks, everyone.